Today we have a very, very, very important piece of research to present. Acupuncture proven effective for migraine relief. www.healthcmi.com, Acupuncture Continuing Education Online. This piece of research was published October 7, 2020. Again, if you went to healthcmi.com and clicked on news, you can see the entire article, all the research with the title. Acupuncture proven effective for migraine relief. Simply go to the newsroom, click on news. Acupuncture is a cost-effective and safe treatment modality for the alleviation or elimination of migraine headaches. Harvard Medical School, Georgetown University, University of Arizona, and Louisiana State University researchers report findings showing that acupuncture reduces the frequency, intensity, and duration of migraine attacks. So for some, we can eliminate it completely. It takes time. It's not an overnight success. This takes some work, repeated treatments, 20 weeks easy, once a week. Some we can eliminate, some we can reduce. But all along the way, they're going to be getting that less frequency, intensity, and duration of migraine attacks. Again, from Harvard, Georgetown, Arizona, Louisiana State, LSU. These are heavy-hitting researchers doing really good work. It's important. Why is it important? Well, globally, migraines afflict 14.7% of the world's population. And according to the Mayo Clinic, 1.5% of the USA population has received acupuncture treatment. However, migraines afflict 15.3% of the USA population. Now, females are disproportionately affected, with 9.7% of males getting migraines and 20.7% of USA females suffering from migraines. So, Chinese medicine, for well over 1,000 years, has had very strict protocols for the treatment of migraines. And even though this meta-analysis made by these researchers at some of the most prestigious schools in the United States, even though they did all their homework, they even cited other people from other peer-reviewed journals who had done great work on the same topic with the same conclusions. They even quoted a Cochrane systematic review showing that acupuncture reduces the duration and frequency of migraines. They also found out that other issues like depression and anxiety are also lessened in patients who get migraines. So that's really neat. They even got into some very, very deep science. And they go into details here about magnetic resonance spectroscopy. That's a type of MRI. And what they found is brain metabolites are involved in the transmission of pain due to migraines. And those levels decrease when there's a migraine attack, even prior to a migraine attack. However, acupuncture restores the normal level. We can see that with the magnetic resonance spectroscopy. And the migraines are correlated with going away with that increase in the level. So acupuncture has an effect of normalizing brain metabolic activity. And that demonstrates a role in reducing pain due to migraines. So this is not a question mark about how it works, or does it work or does it not work. This is quantifiable, measurable, repeatable phenomena using magnetic resonance spectroscopy, which adds basically the use of ions or protons to measure chemical metabolism changes in the brain. A whole lot of studies. They covered a groundbreaking retrospective in this meta-analysis of 21,209 patients with migraines. They find that not only is acupuncture effective, it is cost-effective for the treatment of migraines. And patients who are treated with this have a lower risk of depression and anxiety. Very simply, migraines are a major cause of disability. They can really predispose a patient to depression and anxiety. So getting to the heart of this treatment is very important to prevent other issues like that. The article is fascinating. It's amazing work. They look at another meta-analysis published in the Journal of the American Medical Association, JAMA, Internal Medicine. And there's a 3-arm investigation comparing true acupuncture, sham acupuncture, and a control group. And true acupuncture produced less migraine attacks, less total days with migraines, and less overall migraine symptoms when compared with sham and control group. So there's a lot here. This thing is packed, involving tens of thousands of patients over years of study. In my own clinic, 30 years of treatment of patients, I have found that uniformly acupuncture is effective for the treatment of migraines. Now, I'm not going to say I can get it right away. I have seen people come in, and after 10, 15, 20 treatments over a period of a few weeks or months, it's mostly gone. And maybe they come back every few years with a little flare-up. I've seen other people where they have such vicious, frequent attacks that it can take months or even years to fully resolve it. But here's the good news. One of my most serious cases, for example, now this patient had 2-3 day long attacks. And these are awful. There's nausea, there's vomiting, there's auras, severe pain. Even in that case, the patient got better. But the process, again, this is one of my more severe cases, was not so simple. What patient had to come in 2-3 times a week for 2-3 weeks, then once a week for another 6, 7, 8 weeks, and then 1 or 2 times a month for approximately 6 to 8 months, something like that. It really went on for a while. Like, wow, this is regular. And finally, now of course, as you're going along, the attacks are starting to back off. They're not as frequent. The duration is a little shorter. The intensity is a little less. Now, fast forward 8 months later into the treatment regimen. The patient still gets migraines, but now they're occasional. They're not every week. They're not necessarily even every month. Patient can sometimes go even a couple months, but then they come. So that is not 100%, but for that patient, it represents such a lifestyle change as opposed to getting them every week that it's welcomed. So again, acupuncture has a range of effectiveness from completely cured to effective. It is highly unusual for an acupuncturist herbalist to not get good result. Now, they have to be a licensed acupuncturist with a full training from a good school, good training background. It can't just be someone who says they're an acupuncturist because they feel like it. I mean, you don't just go to a surgeon and they say, well, I do surgery. I don't need one of those degrees from a medical school. We see this wild stuff. It's not even legal to practice that way, but a licensed acupuncturist, so you can check with your state board. You can check with the NCCOM for national certification. Let's say you're in California, the California Acupuncture Board. Illinois has a board. Every state has a board that oversees it. You make sure you get a licensed acupuncturist. And in many states, licensed acupuncturists are required to also know herbal medicine. If they have that 1-2 combination, migraines are definitely going to diminish. So again, that's the important thing, is getting in there, getting the right qualified acupuncturist and getting the job done. I have always felt that every emergency room in the United States, Canada, wherever, should have an acupuncturist on staff specifically for this. So while the patient is in the waiting area, waiting to be seen, then waiting for maybe an MRI if they thought there was a risk of stroke or whatever, and blood tests, and sitting in a room under those fluorescent lights in some uncomfortable chair. They can't even lie down. It's 3 a.m. and they're suffering and they just want to get some medication, maybe something like Imatrix to stop the pain. Maybe they could have just had a 30 or 40 minute acupuncture treatment while they were waiting, just to take the edge off, take the pain away, get them happy and comfortable, resolve the condition, and one step forward to never getting it again. I've always felt strongly about that. There's tremendous pushback in the system. While this does exist in medical centers, it's not that widespread. So I feel like there's a lot of time and energy wasted on a lot of suffering that doesn't simply need to exist. This is core Chinese medicine here. So I want you to take a look at this article. Again, Harvard Medical School, Georgetown U, University of Arizona, etc., LSU. Good research, good people, good results. And if you suffer from migraines, you should get those results too. If you know someone who is suffering from migraines, definitely get them a good acupuncturist to get going on this. Don't expect it to be immediate. It can take a while. That's not unusual, but we can get it. That's the important thing. This is not new to Chinese medicine. We've been doing this a long time. So migraines in the Chinese medicine system, well over 1,000 years of documented case histories. And it's nice to have some modern medicine here showing us not only that it works, not only that it's cost effective, but even mapping what happens in the brain when you get acupuncture and how that helps someone. So I really like that. There's a lot of stuff here with follow-ups, years later, which is great. That's very important because the short-term results are great. If someone comes in with an acute attack, the first thing I do is stop talking. Second thing I do is if there's music in the room, turn it off. The next thing I do is dim the lights and say, just relax on the table. Don't do as big an intake because they're suffering so much. Just get them on the table. If they have any nausea, we can instantly relieve that with needling PC6 Naguan, which is by the wrist area. One needle there, nausea's gone. That's instant. Once the nausea's gone, we start addressing the pain. Get a little edge off the pain. Patient starts to feel a little better. I can slowly ask a few questions. Get them some peace of mind. Always give them a little longer treatment if I can, because sometimes the migraine patients, they take a little longer to get that pain completely gone. Sometimes, even after the acupuncture, they have a little hangover. That's what I call it, the migraine hangover. They feel like they've been beaten up by the migraine, so they've really been worked over. It's a lot of pain. And even if you get rid of the pain, there's this fatigue and after effect and dullness. Someone just needs to rest, relax, and recover. So patients can literally expect immediate results. But what's more important is the long-term results of preventing the attacks. And that's all in there too. This article at healthcmi.com is very specific and gets into all those details of how acupuncture is also proven to prevent attacks and is more effective than medications in preventative medicine. And there are some problems with some of the rescue remedies that fight migraine pain because they can lead to rebound syndrome where it's worse over time. So acupuncture plays a very important role, if not one of the most important, if not the single most important key role in the treatment of migraines. I want you to take a look at this article. Again, it's entitled Acupuncture Proven Effective for Migraine Relief. Go to healthcmi.com, click on News. Thank you for listening. I'm Adam White, licensed acupuncturist. www.healthcmi.com.